We all know the drill. You finally get in the mindset to go for a physical, or maybe you have a health issue that's too minor for the ER, but too annoying to wait weeks or even months to see your doctor. Well, according to a 2017 survey by Merritt Hawkins, it takes an average of 24 days to schedule a new patient-physician appointment in 15 of the largest cities in the country, and that's up from 18.5 days in 2014. The reality of all of this led the Allegheny Health Network to set out to do something about it. 2 years ago, the network introduced same-day appointments for primary and specialty care, and now it's expanding the concept. Kenyokee Crowell is Senior Vice President for Clinical Access for Allegheny Health Network, which is a unit of Highmark Health, which is a sponsor of our region's business. Welcome. Good to have you here.
Thanks for having me. Glad to be back.
Yeah, how about this? I mean, the numbers are pretty daunting when you look at the delays, and it's no surprise. Anytime you try to get to see your doctor, you can't see your doctor.
Absolutely. And, you know, we are in a time where things are on demand. You know, there's so many industries that are always there when customers need them, whether it's mobilely, on the phone, offering different options to connect. And we really just felt at Allegheny Health Network, trying to be patient-centered, we really needed to up our game in terms of how we connect with our patients, and we thought same-day appointments was a really great way to start doing that.
Well, it's true. We do on-demand and everything else nowadays.
Yes, we do.
Why not healthcare? So we had you on the program about 1.5 years ago, just after you rolled this out.
Yes.
How's it been going? Are patients responding to this?
Yes, I think the patients have responded extraordinarily well. We have done over 270,000 appointments since we started this. About 20% of those appointments are new patient appointments, which means they are brand new to AHN or new to a different specialty within AHN. So it's been extraordinarily popular. We've gotten feedback from patients that's been very, very positive. We've also take every piece of feedback that we get from a patient very, very seriously, and I think over time it's allowed us to keep this program going, build upon it, and make it better as we go about our work.
Well, it's a fascinating thing because it really is more than a technological problem. It's also a cultural issue. You got to get everybody, the doctors, the nurses, the whole system to buy into this.
Yeah, absolutely. And you know, we were very fortunate that we had a lot of other people on the team that worked very closely with us, from IT to provide the technological support in the system to make sure that we could build inventory that would be available for these appointments.
Doctors got the time.
Doctors
got to have the time.
Got to have the time, and also making sure that we are not putting an undue burden on our physicians, and making sure that we can still keep the quality of the care high. So our physician leadership, our practice managers, our team over at our centralized call center were all really, really key and actively involved to make the whole program a success. So
you made some real progress in terms of the same-day appointments. Are you looking at expanding this kind of strategy to other areas of healthcare as well?
Yes, we are. And in April of this year, we launched a cancer answer line, which is 24/7 access to registered nurses that can talk to patients that have questions about seeking care, newly diagnosed, really just have issues, concerns they want addressed. It's also a resource for caregivers as well. We think this is a really unique service that's very, very patient-focused, and it's open to current network patients for Allegheny Health Network, but it's also open to the public, to caregivers, and we're really excited about it. We are seeing about 104 calls a week is what we're averaging since we've started this, and we're very, very excited to see that we're helping that many people on a weekly and a monthly basis. So we're really excited about the program and the benefit that it's providing the greater Pittsburgh community.
Well, and I can see the value because so much of oncology care and all care is kind of getting pushed out to the home these days.
Yes.
And, you know, an issue comes up in the middle of the night and you're the caregiver. Who do you call? What do you do?
Absolutely. So this is a resource now for people just like that, and it allows them to call, to talk with a nurse. We're noticing sometimes these calls take a little bit of time, but it's great. You're on the phone with someone who can help you, who can say, you probably need to come in for a visit, or that sounds serious, you need to go to an emergency room. So really talking with patients and providing an additional layer and level of access to care for oncology oncology patients, which are very special patients that require special care.
That's really exciting stuff. I also know you're experimenting with video visits as well?
Yes, so we do have video visits that we've launched and e-visits within our organization, and that is, of course, for a subset of diagnoses.
Sure.
Obviously, if you're severely ill, you would need to come in and actually see a provider, but we do offer video visits as an option. And again, we feel that we need to start really continuing to build that toolbox of ways to provide access to care for our patients when they need it, where they need it, and how they need it.
Well, you think about so many visits, whether it's with the nurse or the doctor, a lot of it is them asking you questions,
yes.
you answering questions. I think you could probably find out a lot just
yes.
with a conversation.
Absolutely.
In many cases.
Absolutely.
Yeah, so where do you go from here, do you think?
So we have some other things that we're working on that we look forward to sharing in the future in order to build upon the programs that we've had, and again, keep being really laser focused on being patient-centered, being there for patients, and really kind of challenging ourselves to come up with new answers to that question of how we connect with them.
Yeah, really cool to see all this happening right here in our region.
Yes,
Kenyokee Crowell, Senior VP at the Allegheny Health Network.
Thanks so much for having me.
Again, yeah.
Thanks.
And we'll be back in a minute with a little dollars and cents. Stay with us.